Growing pains for the Department of Child Safety.
The changes that need to happen are cultural and a long time. I mean, obviously we've got to get the immediate intervention right, but the changes that are going to happen to the system aren't going to happen overnight.
Watching out for caseworkers and nearly 20,000 children.
These are some of the most vulnerable children and families in our state, and we really need to do the best for them.
As the caseload grows, so does agency turnover. This is Arizona Week. A pilot program designed to help foster families is making an impact in Pima County. Arizona Public Media's Christopher Conover has the story.
24 churches in Pima County are opening their doors, storage rooms, wallets, and hearts to work with the Department of Child Safety to help families in need. It's a program called Care Portal.
Oftentimes a caseworker knows the immediate felt need of a child or a family, but it's very difficult to get that out to the people who can really do anything to meet that need. So believing that the church is called to care for widows and orphans, as it says in James 1:27, that's pure religion, caring for widows and orphans in their distress. We have an opportunity and a responsibility to help DCS meet the needs of these children in our community.
When DCS finds a family needing assistance, Care Portal sends an email to member churches asking for help. At First Assembly of God in Tucson, it's Lena and Joe Crandell who get that email.
Since we're a team, husband and wife team, it's kind of simple. He's right next to me or I'm right next to him, looking at the computer requests, and we talk over with each other, we pray about it, and if it's something we feel like we can do, we bring it before the church.
Those requests can run the gamut.
We've taken toddler beds, regular beds, bunk beds, food, dressers.
The Crandells scour the internet for good deals on things families need. The most exciting for everyone is beds.
That's a good one right there.
Oh, that's perfect.
Because it has a dresser included underneath.
The kids, they love it whenever you bring them a bed. They jump on the bed immediately. As soon as you set it up, they get on the bed and they go, "Oh, Mom, is this mine?" And they just love it.
Care Portal doesn't take money from DCS to run the program. The funds come from donations, something that could put a strain on church budgets.
This is something that everybody could be involved with. If you can only throw $1 toward it, you know, that goes a long way when you have needs like mattresses, beds, dressers, bedroom furniture, or a sofa for the living room. And so everybody has been very generous.
DCS is often seen as the bad guy, the people taking kids out of homes. But officials say partnering with Care Portal is about just the opposite.
It's to keep kids out of the system. It's to preserve them with people they know and their love. We believe that when it's not safe for a child to be in a home with their family, then we should look at somebody else that is connected to that child, who love them and who can give them care in that time. So it's a way that we can reach out to a relative, and they may need, okay, well, we need a bed to do that, or we're not set up yet, or, you know, we're going to take 4 kids to their home, and so maybe they just need some, you know, extra help through the week. And so that's what it's really about.
I think we have that inside the funds. We should really just take that one.
Care Portal launched in Pima County in December. Officials say they want to take it to Maricopa County based on 3 months of success.
It is working. We are following up. We do a week follow-up. We're going to actually follow up to see if this is really working. So it is, although it's in our early stages, even the families that have been helped in the last couple of months, they're still with family. We haven't removed children.
The goal is to get more than 100 churches involved in Pima County by the end of this year, not to mention the expansion to Maricopa. For churches that are worried about taking the responsibility on, Pastor Munns understands how tight budgets get, but he says that's not an excuse.
So it's almost like, I can't do anything right now. Well, now's when it's needed. So I would encourage people just to stop something else that you're not really being hands-on and effective with, and let's keep the kids with their families, and so there's not all this shuffling kids from foster care in different places that they might have to stay, and just keep them with their families.
Nearly 20,000 children in Arizona are out of their homes and considered to be in state custody. Senate President Andy Biggs says lawmakers take that number seriously.
We've increased funding there like 350% over the last 4 years. And as you say, we continue to see caseload growth, and sometimes the priorities are not really what I personally, and I think a lot of my members would like to see. I think we all can come to the bipartisan conclusion now that it is better to keep a child in their home with services where possible. But our removal rate is an outlier nationally, so we're taking away too many kids, and I think there's kind of a consensus across both party lines with that. But what I would tell you is that as we look at it, and if we check it out with budgetary issues, we check it out with policy issues, those are going to be related to one another. We want to see progress, and if we see progress or an area of need, we want to know that area of need is being met, both resource-wise from a budgetary standpoint, but certainly from a resource-wise from the human capital side. And so this is really the problem that we have. And I think there's no one here that's saying this is fixed or we're content. I think everybody here is very concerned and wants to see further progress. And I think the fact that it continues to remain at the forefront of our discussions, whether it's budget or policy, I think that's actually a good thing. So I was originally, let me give you for instance, I was originally opposed to the removal from DES because they were trying to sell it as an efficiency measure, but I never could see how that could be the case, because when you're in DES, a lot of service providers are housed in DES, and you should be having the communications to make that work. But the one thing I will say that has really happened in a positive way, although a lot of people may not see it as positive, I do, is by pulling DCS out of DES, what you've done now is there's no place to hide. It is under a magnifying glass.
The Department of Child Safety, known as DCS, is one of the largest state agencies. As the number of children in the system grows, so does turnover rate for caseworkers. Here again is Christopher Conover with DCS spokesman Doug Nick.
We've seen in the last several months especially some really encouraging trends. For one thing, our service wait list is down, which is excellent. Services that go to families that may be in crisis, and that's a great measurement of intervening before a crisis gets out of hand and a child is in danger or needs to be removed. So that's a good trend to see that wait list going down. And also we see the backlog of inactive cases being whittled down very significantly, about 22% since Director Machiche took office almost exactly a year ago. When he started, that list of inactive cases, the backlog, was a little over 16,000. As of today, it's at about 12,500. That's about a 22% drop. So that's excellent news. And that shows a lot of hard work on the part of our field staff and supervisors, people out there in the offices doing the job to close those reports that come in, to complete the cases that are comprised of many of those reports. And it's a real testament to their hard work and also to the productivity of our staff. So there are just a couple of really encouraging signs that we see.
The director spoke recently with the Senate Appropriations Committee, gave all the numbers. Some of those numbers are up, especially the calls coming in, but the number of reports filed is changing.
Well, you look at the number of reports that come in, or rather the calls that come in, we answer the phone regardless of who calls. And many of those calls are mundane in terms of they're not something that is an allegation of child abuse or neglect. It may be somebody that calls in the middle of the night to get a phone number of a caseworker, and it's not an emergency, it's not a report. So the number of reports that we take for investigation in the last calendar year was somewhere in the neighborhood of 51,000. We're projecting about the same number, maybe a slight increase this year, but then it's leveling off. And so the reports that come, or I'm sorry, the calls that come in is a reflection of whoever calls our line, and the reports are a reflection of our hotline experts looking at the call and determining, okay, does this rise to the level of a report that needs to be investigated, and if so, what priority? So we're seeing some leveling off there, and part of that would have to do, again, with lowering the service wait list, because services are getting out there in a more rapid time before trouble becomes much worse in a family. And also, when we lower the reports, so the number of reports, we complete more of them, that frees up personnel hours to address other matters that need to be attended to in the agency. So it does have a very healthy metric to it.
One of the things the director has talked about publicly, and we hear in legislative halls, is the use of private contractors to help out. How does that work?
Well, there is legislation to that effect, and we'll see how that plays out. We certainly welcome assistance. We want to make sure that our role as a state agency, as it's laid out in state law, there are certain things that we as a state agency must do in terms of investigation. So there are some areas there that need to conform with the law. But when it comes to getting some assistance in some areas, there are proper vendors and service partners that we work with to provide services, but also some other areas, like when we talk about lowering the backlog of inactive cases, we had another state agency come in to help us with some administrative work, freeing up our professionals to do their professional job. And we also have some vendors that are helping us in that regard now, so that we can knock down that backlog a bit more. So we're certainly willing and happy to have that assistance when it's appropriate and when it's done in a way that furthers the statutory mission of this agency.
I don't think anyone will ever say being a caseworker for a child protective agency is an easy job. 2 o'clock in the morning phone calls, long days without those phone calls. There's a big attrition rate, and the director addressed that. How do you deal with that attrition rate?
Well, our attrition rate, we are not an outlier in the country, and among other vendors that are not state vendors, service providers, I should say, we're right about in line with that. That isn't to say, though, that it's true. We do have an attrition rate that we want to bring down. We have in our plans that were spoken of in the appropriations process some ideas for merit pay and some incentives, spot incentive pay, that kind of thing. But one thing we're also doing is with the increase in the ability to train our people and help them to do their jobs better, and to bring in these other entities that come in and can do some of the administrative tasks, that frees up our professionals again to do the professional work, and that helps them when they're doing the work that really deals with a child's well-being. That helps really bring home the fact that they're doing this to help a child. So it's a multi-pronged effort with again, the merit pay proposal we've talked about, more training. They get 22 weeks as they come in, and then we've added 3 weeks, not consecutively, but 3 weeks added to that over time of advanced training. And the more you give people these tools, the better they can use them, the better they feel about their job. And the more that we deal with these reports coming in and get rid of that backlog of cases, that frees up work that is meaningful work in terms of getting to a child who may be in danger.
Turnover in DCS is at about 35%. The year before, it was 25%. The agency says Arizona caseworkers average about 6 years on the job, and their average salary is about $41,000 a year. Here's Timothy Schmaltz from the National Association of Social Workers, Arizona chapter. You've asked the legislature, and continue to, not give up on the agency. What do you mean by that? What are you really petitioning for?
If you don't add additional resources, if you don't update the technology, if you don't hire qualified professional staff who know the best practices, if you don't have inspiring, pragmatic, good leadership, you can't make this work. And in the end, children and families are the ones that suffer. It's the child who languishes in foster care who doesn't get an adoption. It's the child who languishes in foster care who doesn't get returned to his parents. All of those, when you give up, that's what happens is that children suffer. And these children have suffered enough. The reality is that they may have been removed. They may have experienced neglect. They may have been hungry. All of these things, when you give up on the agency, when you don't provide resources, technology, qualified professional staff, and qualified, inspiring leadership, you end up with kids caught in this system.
How would you fix the agency? A lot of legislators will say you just can't throw more money at it. So what do you do?
Well, there's a lot of question about leadership right now. I think that one is that I think that the agency needs highly qualified, highly professional child welfare leadership as a start. I think, second, I think we need to raise the salaries of the professional staff on the line. Probably, in our estimate, analysis, by $10,000. Now, that's a lot of money. But it will stabilize the agency because people are leaving the agency because of all of these morale and caseload factors. And we need to stabilize that workforce as a way to do short and long-term solutions. So more inspiring, qualified leadership, highly paid, highly qualified staff. I'd make most of these jobs require a master's degree in social work or a related field, a very closely related field, marriage and family therapy. We need to strengthen the community agencies that are providing the service, alcoholism treatment, substance abuse treatment, family counseling, all of those kinds of things. And I think we need to be patient a little bit if we did all of that. It takes more resources, technology, qualified staff, and then a little patience. But if we don't do those things, we're going to be here another year from now, 2 years from now, if we don't implement some of those solutions that we know are out there. Best practices, inspiring leadership, small caseloads, highly qualified staff, highly paid staff, those kinds of solutions.
As you said, sticking your finger in the dam.
Yeah, right now we're sticking our finger in the dam. And we're not doing a very good job. We're leaking a lot. 35% turnover says that we're leaking a lot, that dedicated people are leaving. I know that I've had people say that to me. I had a young social worker the other day. As soon as I'm done with my commitment to the department, that she got her master's degree, I'm leaving. And I said, why? She said, it's just too chaotic. I can't, I want to serve children, but I can't do it that way. And that's the wrong answer. I mean, here is somebody who wants to dedicate their lives, but we need to encourage and inspire and frankly pay them well enough and keep them qualified to do it.
DCS Director Greg Machiche has led the agency for the last year. Minority Leader Eric Meyer says he's disappointed with leadership thus far.
He painted a good picture, but the facts don't support the picture he painted. You know, he's talking about reducing the number of cases in the system, and that could be happening. We don't know. We don't get numbers right now on a frequent enough basis to know. But what we do know is that we're short over 400 caseworkers, and that number hasn't improved. In fact, under his leadership, that number has gone down. The number of caseworkers has dropped, so there's a bigger deficit than when he started in the job. The number of kids taken out of the home is approaching over 20,000 now that are in either foster or congregate care. The courts are backlogged, and we keep, at least I keep on, and so do many of my members and my caucus, keep on hearing stories about parents having problems and not getting services, so foster or congregate care, not getting services for mental health treatment, and a whole bunch of other things. So it's not a pretty picture, you know, and this is Governor Ducey's hand-picked guy who doesn't seem to be capable of doing the job. I mean, it's a huge agency, $850 million agency.
Sometimes we hear that it doesn't take necessarily more money, maybe just a restructuring of what currently exists.
Well, we have invested heavily, and it's $850 million budget. And when I asked the director, for instance, how he's spending his money on those preventative services to keep kids and parents together, he couldn't give me an answer. So money helps in some cases, but we need to know how it's being spent, and we need to hold the director accountable. So if we do give him money in this budget, we would recommend that there are accountability measures in place to make sure it's being spent appropriately and that we're getting the outcomes that we should be getting.
Arizona continues to be one of the worst states in the country. Why is that?
Well, we were making a little progress after we removed the agency and made it a standalone under Director Flanagan. So there was a number of those non-investigated cases and the backlog started to shrink. But we just aren't doing what other states have done. And we paid for an audit that said these are specific things other states have done that you could do to change the course. And none of those policies have been adopted by Director McKay. And they, it's like a tool that assesses a child and whether they're safe to stay in or out of home. We aren't using an appropriate tool. And our Auditor General said the same thing. And then we have to invest in services that keep kids in the home. Most of the kids coming out are because of neglect. So they don't have food or health services or child care. Or maybe drug or alcohol or mental health treatment. So those are the kind of things we could invest in. And now the governor's budget doesn't do that. In fact, it cuts funding for that again. So it's not a good situation, and we need to change course. And I don't know what it's going to take, hopefully not a tragedy.
Lawmakers have introduced 2 child safety bills this legislative session. Here's Representative Rebecca Rios.
We had 2 bills this year, and one of them had to do with the backlog. And it essentially went as far as redefining the backlog. And I was very opposed to that bill because now not only do we have the problem of the backlog, now we're changing the metric of how we measure it so that when we have him come report in 3 months or 6 months, we have narrowed that definition. So clearly he's going to show up and say, oh, the backlog has decreased. Yes, but you're now not comparing apples to apples. You've changed the metric. And so I'm very concerned about that bill that's going through the process. I'm sure the governor will sign it. It's an agency bill. The other bill that I was very vocal in opposition has to do with the hotline. It's very hard to get people to call and make reports when they think a child is being abused or neglected. Last year there were about 100, I think, per his report or his testimony, about 143,000 calls to the hotline. About 43,000, roughly, these are rough numbers, were investigated. So he and the department came and had a bill that essentially said, you know what, there's all these calls that really were not able to investigate or worthy of an investigation. So, we're just going to ask you, legislature, to give us permission to not even take the reports. And so now we have a bill going through the process that, again, limits the types of reports that will even be taken. And for me, that's very troubling because the hotline is the first step. And if you now put a bill out there that sends a message to the public that, you know what, many of you are calling unnecessarily, I think you're going to have the chilling effect of people second-guessing themselves and saying, you know what, maybe it's not what I think, maybe I shouldn't get involved, I'm not going to make that phone call. The other part is, you may have 1 or 2 or 3 different reports that don't rise to the level of an investigation, but that 4th report comes in and they're able to see a history and able to go, wait a minute, we have a call from a teacher and a neighbor, somebody get out there and see what's going on. Now you're not going to have that history because this bill will in essence give them permission not to take even reports on specific types of calls, and I think that's really concerning.
Arizona ranks as one of the worst states in the country when it comes to child safety, and some lawmakers say it will take time to overhaul the agency. Representative Chris Ackerley, thanks so much for being here.
Well, thank you for having me.
Child safety, where is it right now? The numbers keep growing, and we're hearing that there's a bleak picture that's being painted.
The numbers have increased. The number of reports coming in have increased. What the director has testified to is that they're right now able to keep up with the numbers, but that has not allowed them to make a whole lot of progress on the backlog that has made the press quite importantly over the last past couple of years.
What's your analysis of these numbers?
I take him at his word. I think most of the work that we've done on the Children and Family Affairs Committee in the House has revolved around issues with DCS. Couple of important things we're working on. One of the things is that backlog, and one of the measures that we've passed, it's awaiting action on the floor so that we can send it to the Senate, is to allow DCS to contract with outside providers in order to clear some of that backlog. I know in a lot of areas there are nonprofit organizations that work very closely with law enforcement and DCS and a number of service providers, and they have the capacity to help with that, so allowing them to do some of that work to start working down that backlog.
Why does this continue to be such a serious issue in this state?
Well, it's a crucial issue, and it's due to the life and death nature of the issue. I mean, you know, obviously there's some capacity issues, and we have to address those, but at the end of the day, I mean, kids' safety and sometimes their lives hang on the balance here, so we have to get it right. There's no question we have to get it right.
Are there any changes that you see as something that could be done immediately that maybe we're not currently doing as a state?
DCS doesn't have right now sort of a uniform that's publicized criteria on how they're working through cases. Each one of, my understanding is that each one of the field offices has something in place, but it's not uniform across the system, and it's not something that people can point to evaluate judgments, and that creates a whole lot of confusion throughout the system. And so one of the measures sponsored by Representative Townsend this year is to say, okay, DCS, you have to adopt and publish a uniform set of criteria that's going to apply to all of the offices about how you're making decisions as to whether to remove or not remove children. Now, obviously, there's going to be decisions that are going to vary from that. You can't base everything on a checklist. That wouldn't be in the best interest of the kids. But at least it gives you a metrics by which to say, okay, if you're going to differ than this position, then okay, what is the reasoning for that? Right now, there's not that reasoning, and it leads to a whole lot of confusion.
What is most bothersome to you about what's happening within this agency?
I think what's most bothersome is that, quite frankly, we let it get to this point, that there's been a system-wide breakdown. My understanding is that's starting to improve, but we still have, in the agency still has tremendous turnover. And until that problem gets solved, I don't know that we're going to be able to make a whole lot of headway on that cultural shift that needs to happen until they can stabilize the employees at the agency so that you have that institutional knowledge and that you have that experience. And you're not retraining employees over and over and over again.
And that's our program. For all of us at Arizona Public Media, I'm Lorraine Rivera. Thanks for joining us.